performed 10 years ago. I have 4 rods and 8 bolts holding my lower back together. And in 2014, I broke my hip in 3 places at work. In 2015 as well, I developed a 30% hearing loss in both ears, requiring double hearing aids. I'm a musician. I'm a guitar player, and it's really frightening to lose your hearing. And added to that, my lichen planus attacked my tooth enamel, leading to many teeth breaking off at the gum line, severe abscesses, and ultimately requiring full upper extraction. I am scheduled for lower extraction this year. I worked with the public. I was a product consultant with the Liquor Control Board. I worked there for 31 years. I worked with the public, and it's very hard to sell vintage wines and very fine scotches when your teeth are breaking off. After extraction, I experienced hemorrhaging of my nose to the extent that I was drowning in my own blood, and it was blocking my airways. My nose needed to be cauterized. At this time, I started to experience internal bleeding, which led to a diagnosis of colitis. Dr. Bala is very good at coordinating additional services for my treatment, requesting referrals to many specialists, requesting additional tests, MRIs, x-rays, etc. However, because the wait times for these services in London are among the highest in the province, as a practicing physician trying to obtain timely medical care for her patients, her efforts are being hampered by these delays. I mean, you're aware of that yourself. I'll give you an example. Well, as a patient, these delays not only increase my frustration, they contribute greatly to my level of stress and ultimately to increased disease activity. I have been affected not only physically, but psychologically and financially as well because of these delays. I will give you an example. I injured my hip at work in 2014. I was given an MRI in June 2014. I was given an MRI appointment for October. With no clear medical proof of injury, I continued to work. Fortunately, I live alone. I'm sole support. There is no other income coming into my home. I continued to work. Fortunately, I was able to have an MRI performed on July the 28th. So that's only a 6-week wait due to a cancellation. The results showed that my pelvis, my lesser trochanter, and my femur were fractured. I continued to work unloading trucks at the LCBO for 6 weeks, using a cane, unloading trucks. However, as I had continued to work while awaiting my MRI appointment, I lost credibility with WSIB and my claim was denied. So in order to heal my hip, many weeks rest were required. Because my WSIB claim was denied, I applied for unemployment sick benefits. For 12 weeks, I was reduced to 0 income, with no explanation as to why I was not receiving benefits from UIC. UIC had sent me a letter that my application was received. A week later, after I applied, at the 12th week, I finally spoke to an agent who noted that my file had been closed as my address was non-existent. So there are not only delays in medical, it kind of steamrolls. You feel like you're on a hamster. You're just going around and around and around, and it's escalating and escalating. And there's even delays in systems that are meant to help people. So, not only do medical delays dim a patient's hope for timely treatment, these delays also have a financial impact, which in turn increases stress, which increases disease activity. I was last year, 2016, I was approved for CPP disability and long-term income protection provided by my employer. While going through that process of documents being sick, for 4 months, I was forced to collect Ontario Works, which is a pretty word for welfare, while facing eviction from my apartment and shopping at the food bank. I had a whole lot of help from my brother. There's my brother Bob Braden right there, and my sister Susan Orpana. Without them, I don't know what I would have done. So, thank you very much for listening to my account of my struggles, and that's all I got to say before I start crying. Thank you very much.